on a daily basis, new policies are being issued by the CDC. They're being issued by the White House. They're being issued by our own state government. They come in the form of executive orders. They come in the form of press releases. Our clients, as I'm sure many of you listening today, are being bombarded by all of these guidance documents, regulatory criteria, whatever it might be. And it's very difficult to determine what does and does not apply to you. But there is a small light at the end of this tunnel. And that light started to glimmer yesterday, certainly in Connecticut, as for some sectors, those being restaurants for outside service, offices, retail, and hopefully soon to include hair salons and barbershops, sector rules have gone into place that has allowed these businesses to begin to reopen. And hopefully, this is going to be a positive trend, and we're not going to find a step backwards, and we're going to see other sectors beginning to open up. Now, whether you're an essential business who's been operating throughout the pandemic under the essential business category, or whether you're a business who just opened yesterday, or whether you are somebody who's hoping to open soon, whatever it might be, you are all facing many questions, but the primary question is how? How do I open safely and without creating liability for myself later on, and either liability arising out of from my employees, from my vendors who may be coming into my place of work, or from my customers. So again, this program is designed to help you, give you some guidance in those particular areas. Now, and again, as you probably know, there's no one size fits all solution or solution to the issue. Even those folks who are issuing the guidance documents, they can't drill down to the specifics of your own company. But again, some general principles can be used, and that's what we're going to talk about today. So with that, let's talk about some of this. I'm going to give a summary of the key OSHA, the Occupational Safety and Health Act, policies and procedures that are going to apply to all employers. This includes those of you who previously had never had any exposure, if you will, and no pun intended, to OSHA. You now, because COVID-19 is a recognized illness under OSHA, you are going to have obligations under OSHA. And those obligations are going to arise out of, well, first of all, OSHA has issued a guidance document, and that's really what we're going to be focusing on now. They issued a guidance document specific to COVID-19. Now, they go out of their way to say in that document that it's a guidance document and not a regulation and not a law. But the reason why you need to pay attention to it is because OSHA has a general duty clause, which basically could apply and could make that guidance document legally binding upon you. And we'll talk a little bit about that later on. There's also the risk of negligence. Under some circumstances, if there is a guidance document that's been issued or something by a trade organization that sets forth recognized standards of practice, and you aren't following those standards of practice, and a vendor comes in and gets harmed, you're not providing, particularly in this case, proper protection elements of a negligence claim. In addition to that, again, there's the general duty clause, and then Rob is going to talk a little bit more about some very specific employer reporting and record keeping obligations. So I've talked a little bit about this guidance, about this being a guidance and not a regulation. What it does is it creates basic steps applicable to all businesses. And what the guidance does is requires that you classify risk, your employees, by risk level. What's their risk of exposure based upon the duty that they're doing? if all of your employees are office employees who have no exposure to customers or vendors, then the risk may be low. But also keep in mind that COVID-19, the CDC has identified very specific risks for certain classes of people who you might think like the office worker is a low risk, but if that office worker is over the age of 65, then they may have a very specific risk that you need to address under COVID-19 policies. Similar for persons who are pregnant. So you need to classify your employees by risk. Then what you are required to do is develop an infectious disease preparedness and response plan. That's what OSHA calls it. You can call it anything you want. But the concept is it's a plan by which you develop through the use of what are called hierarchy of controls, methods and procedures to protect your employees, and in turn, it will provide protection to your customers and the vendors who come into your place of business. This is going to be a dynamic document. As I mentioned before, the policies and procedures are changing on a daily basis and certainly a weekly basis. And somebody needs to keep up to date with all of those changes and make sure that those changes are incorporated into your plan. I mean, even at our firm, we have a site that's designated to COVID-19, and we're trying our best to keep up with all of those policies, and we publish them on our website. Other firms are doing the same, and so are other professionals. So there are resources out there that you can use to try and keep up to date, but you will have an obligation to do so. The plan is going to require that you be ready to implement infection prevention measures to keep the COVID-19 from being in your place of business as much as you can, and then to develop policies and procedures for prompt identification and isolation of employees who become sick or may become exposed to somebody with COVID-19 at home. And again, that's going to employ what's called this hierarchy of controls. Hierarchy of controls. The whole concept of hierarchy of controls begins with the premise: the best thing you can do is remove the risk, get it out of the workplace, or substantially limit it. And the best way of doing that is through what's called an engineered control. Engineered controls, we've seen them. You go to the grocery store, that acrylic barrier between you and the cashier, that's an engineered control. It's there to design to create a physical barrier between potential exposure between you and that cashier. Other physical items that are done include that you may not see are done behind the scenes. A business may be installing HEPA filters. They may also be doing substantial modifications to their HVAC systems to make sure that there's adequate ventilation and circulation. The next level of control are controls that are administrative controls. And these are going to be the most common ones, and oftentimes the most common sense ones. These are policies and procedures to be implemented by the employer and by the employees. The one that we've been doing ever since this thing started: social distancing, maintaining procedures to keep people 6 feet apart. You've seen in certain businesses tape on the floor around chairs to keep the chairs in certain locations. You've seen the pathways marked on the floors. There are many, many different types of administrative controls that can be applied depending upon your type of business. Alternating shifts so that only certain people work the same shifts on a regular basis. And the reason why OSHA would like to see the same people on the same shifts is for later on for what's called the contact tracing. If somebody becomes ill, then the exposure to that person, that employee, is maybe limited to only those people working on that shift. Employing video meetings, restricting travel. There are a whole host of things that OSHA identifies in its guidance document, and which Rob and Adam and Christy will talk about, that you can employ to have these administrative controls. And then the last is PPE, personal protective equipment. And that's the masks, those are the gloves. And what type of PPE is provided depends upon the employee risk, and Rob is going to talk with a little more specificity about that. And this slide is just simply a visual representation of this hierarchy of controls. It's another way of looking at it, going from elimination of the hazard down to the PPE. So I said before I was going to get back to the general duty clause, and this is the clause that could rope you into being obligated to comply with this guidance document. Section 5A1 of the Occupational Safety and Health Act says that an employer must furnish to each of its employees an employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm. This clause often appears in many of the OSHA orders that I've seen. OSHA will often ding you and penalize you for failing to follow a very specific OSHA requirement, whatever it might be. And then they often will rope in kind of this general catch-all that says, oh, and you didn't furnish a safe area of employment. Well, if you're not complying with the guidance document or doing your best to do so, and somebody gets COVID-19 as a result of your failure to provide them with adequate protection, you could be found to be in violation of the general duty clause. And some of the other specific requirements that OSHA has relate to PPE. And they also, for some industries, healthcare in particular, you have the bloodborne pathogen rules that apply. And then once again, don't forget the possibility of negligence claims and worker comp claims. Those exist and under certain circumstances could create a liability for you if you haven't complied with these various guidance documents. So at this point, I'm going to pass the baton to Rob Lewandowski from Fuss & O'Neill, who's going to get into a little more detail on some of the OSHA obligations. Thanks, Rob.
Thanks, John. I appreciate the lead in. What we're going to look at in this section is we're going to talk about some of the key OSHA obligations that you have and some of the information that you'll need to collect either to prove yourself in to a standard or to prove yourself out. And these measures are designed to help you establish a position as to the work relatedness of some type of injury or illness that you have. So employers in certain industries are required to maintain some type of OSHA record keeping. There are some industries that are exempt from record keeping, but in the case that record keeping is required for your industry, you need to be able to develop the work relatedness of the claim. There was some guidance information that was published back in April, early April, and this information provides you with some general guidance as to the record keeping procedures that you would follow. Next slide, please. There we go. So under these requirements, what they're looking at specifically for COVID-19 is that you would need to have if you had a recordable case, you would be looking at 3 conditions to make it recordable. One is that the case is actually a confirmed case. In other words, someone was tested and they were identified to be positive for COVID-19. And then that job that the person was working in or performing was in fact work-related services. So when they were in the office or they were providing some type of work-related type service. And then there are some other generalized record-keeping criteria related to whether there was lost time, medical treatment, or if there was some type of restricted duty for them to do their job. Those are primarily the 3 cases, the 3 ways that you would make something recordable. You'll see on the second part where we're looking at ongoing transmission, some employers may have difficulty making these determinations. How do you separate between a workplace-related event or something that happened in the community? And I think for most people, especially if you're not in healthcare, those decisions are very difficult to make. And what OSHA is looking for is that employers would try to make that determination, but they're going to give you some other liberties in order to do that. And if we could go to the next slide. So what they're looking for is that if they were to come in to do an inspection, they would look for some objective evidence that in fact that the case was work-related. As John mentioned, there were some controls that you could put in. Social distancing is a very common one that would be put in. And if you did not in your plan, and we're going to get into talking about plans, if you didn't have a plan which establish social distancing requirements, well, then you're getting closer to making that work related because you didn't have a plan established that maintained commonly that 6-foot work distance. There was also, the other case would be that there was evidence that as an employer, we knew that there was something going on that we should have taken the correct action, but we failed to do that. In other words, I put on here as the example of you didn't have a screening plan, and we're going to talk about what that is. So you may have had someone who is showing signs or symptoms of being sick. You allowed them to work in the workplace. They performed their job. You knew that they were sick or they appeared to be sick, and now you've developed that work relatedness where the person was at work, probably sick, and now you would now have to make that as record that as a recordable case for your business. And what they're really trying to do is as you'll see in that one box that I've highlighted, is they really want employers to do the right thing to establish good hygiene practices. So things like social distancing, face coverings, washing hands, antibacterial materials being readily available, those types of things that you should have as a plan in your workplace to minimize this COVID-19 effect. Next slide, please. So there is some information that's out there, and it's available from the Connecticut Department of Economic and Community Development. And I believe the information, there'll be a link to this information. It's readily available. And this information offers some really good guidance on what should be going on in the workplace, to include things like establishing working from home as your primary mechanism still, eliminating all non-essential travel. And you can see what's in the list here, but again, facial covering is a requirement under this DECD criteria. So upon entry into your facility and in common spaces, facial coverings are required. They go through the social distancing plan, which I'm sure people are familiar with, maintaining a 6-foot social distance, and then establishing some type of cleaning regime using approved disinfecting products. And I will show you what that is at the end of this presentation. One of the other criteria that they also talk about is prohibiting people using other people's stuff, their phone, or pens and pencils and all that other type of personal stuff that you might have in the work environment. So those are, again, the DECD has laid this out. It's very basic, and it starts as the basis for your plan, but there's more. And we'll go to the next slide. And what this next slide highlights, and this is what Fuss and O'Neill is putting out, and there's a lot of organizations that are sort of falling into this big 6 model, is establishing a plan that assures that your building is ready for people to return. Some organizations have taken their building, they've shut off the lights, they've closed the doors, and no one's been back since they closed the doors. And before you bring all your people back in or you start to repopulate your building, you want to make sure that your mechanical system is functioning properly, that the filters are changed, that maybe there's, with the system being down, that maybe animals or birds haven't migrated through the filters, and that your system is in fact functioning properly. There are recommendations for doing a fresh air purge for 72 hours prior to people coming into your building, and maybe even doing a filter upgrade. In other words, getting a higher efficiency filter, or putting in more portable filtration units, those HEPA filter units that you can buy in key areas of your facility. So again, getting your building ready, getting your workforce ready. Can you bring back 25% of your workforce first, and then over the next 3 or 4 or 5 weeks, bring more people in as they are prepared to come back to work. Facility access points, establishing points of entry and points of exit so that you can monitor the condition of people, whether they're sick, whether they're good, are they visitors, are they guests, and basically establishing a process so that people just can't enter the facility without going through a certain protocol. We talked about social distancing, but one of the other things you may consider is taking areas where you would have an accumulation of people, like a conference room, and taking that room and dividing it, the floor area, by about 36 feet, and that may give you some guidance as to what a new occupancy capacity should be for that conference room. Again, I'm going to show you some EPA approved disinfectants. I'll show you how to make sure that you're using the right materials, and then to go back, have self-cleaning protocols. People are cleaning their own materials or some common areas, and then basically communicating back so that people feel safe coming back to the workplace. And communication, as you know, goes a long way. I did provide a picture of what we have at Fuss & O'Neill. This is the front door to one of our buildings. You can see this is our assessment criteria. It's a self-assessment criteria. People answer these questions, and if you answer yes, then unfortunately, we don't allow you to come into or enter our buildings. We're looking to make sure that people do this self-assessment to include monitoring their temperature, or if they have signs or symptoms of being sick or some type of flu-like symptoms. Again, we're trying to control people who may be sick from coming into our building. So again, we've put it right at all the different entry points, and you'll also see that there's another image of facial coverings are required in all areas. And again, that's covered under that DECD criteria. So that gives you at least a front picture of the room. So one of the things that many organizations haven't realized is that while record keeping might not apply to all businesses, there is a requirement that all businesses do perform a hazard assessment specific to personal protective equipment. What equipment does an employer require employees to wear in order to do their job? So there is a personal protective equipment criteria that you're probably putting in place now related to this administrative control that John talked about, like facial coverings, where you would have to either develop or update your hazard assessment if facial covering is going to be required in your workplace. That would be an example of where OSHA would be looking at your documentation to look at your plan and have you perform the assessment. What type of facial coverings are you requiring? And what are you doing for employee training? When is it required? What are the limitations? And then how to use the equipment to make sure people actually understand how to use facial coverings. And you'll see that there's a great diversity of practices. People have it underneath their chin and have it on their forehead, and none of that is approved by the manufacturer. They have to cover the nose, and it has to go below the chin. So again, we're trying to limit that exposure to airborne droplets. The third program that we're looking at, so we've talked about record keeping, we've talked about personal protective equipment, and the third primary control is going to be respiratory protection. So again, what are you providing as a company? And you need to make sure that people have information on how to use respirators and then how to assure that the respirator is working for them. And there are some health restrictions that may apply depending upon the respirator or that filtering face piece that you may offer. On the left-hand side of your image, you'll see that that's an N95 filtering face piece. That filtering face piece is considered a respirator. Those are designed to filter 95% of the air. And again, there are some medical criteria and some fit testing criteria to use that respirator. On the right-hand side, it's more of a surgical mask. It's not a respirator, it's not tight fitting, and it does not require any type of evaluation. So if you're going to be using those, you need to make sure that people have an understanding of how they work, how they can get them, and the limitations of the devices and the equipment. Not all respirators are the same. We talked about the respirator that's on the right-hand side, the N95 respirator. The respirator that's on the left-hand side, well, that's also an N95 respirator, but it's not a respirator which you would want to have employees use in your workplace. Underneath that front little cap, there's a rubber diaphragm, and when you exhale, that diaphragm opens, and that could allow airborne droplets of and moisture that comes out when you exhale. that could freely liberate into the workplace. So the respirator that's on the left is really not appropriate for the workplace. While it is an N95 respirator, it's not what you should be allowing employees to wear. So again, that facial covering has some criteria. Still in the respirator mode here, OSHA also put out some guidance related to what to do for respirators. As I mentioned, there are some criteria for these N95 respirators. People have purchased them, people are using them, and there really is some, there's some medical concerns that would go along with having N95s in the workplace. If you could go to the next slide, please. So there, again, with these N95s, there is some criteria related to a medical exam and related to fit testing. And again, if you're using it on a voluntary basis, there is some posting requirements which were listed in a couple of slides ago. But again, you need to make sure that people are using these correctly. If OSHA comes into your facility, they have received guidance that they need to exercise discretion related to the annual fit testing. And fit testing wants to talk about how the facial fit is and the protection that that face piece offers. But the goal here is to understand that OSHA will be enforcing the good faith effort to make sure that you've been doing things correctly. And I'm going to say it's within the spirit of wearing respiratory protection. So while there are very strict criteria, your plan, which we talked about having your plan, specify what are you doing as a company to assure that respirators are being used in the right manner. And if you have that listed in your program, that is going to represent your good faith effort. So you want to make sure you have it in your plan. Next slide. So this will be the final pieces of information that we're going to go through. This is, you should have a hazard communication plan, which talks about the chemical inventory and chemicals that you have in your workplace. As you start to introduce new chemicals in your workplace, those disinfectants, you need to make sure that you are using those disinfectants in the manner which was specified by the manufacturer. There are some procedures which say spray and let air dry, and there's some procedures that say spray and in 10 minutes you can wipe it up. So if you're going to be using whatever product you're going to use, you need to make sure you're following the manufacturer's criteria. And again, contact time generally is a good thing when you're using a disinfectant. If you have a third party or a contract where you have a third party coming in and they provide you or they provide their own cleaning materials, you may have an obligation, depending upon the quantity that they're bringing into your company, to have a safety data sheet, because now it might not fall under that consumer product exemption. So again, if you have that service, working with that service to make sure that it's a registered disinfectant and that you have safety data sheets available so that you know what's coming into your facility and that you can verify that it's being used correctly. So where do I get this information? This information is on the back side, generally, of a consumer product. And I've tried to show some arrows. They might be hard to see, but again, on the lower right-hand side, you'll see that there's an EPA registration number. So you'll see that that is an approved disinfectant. It's EPA approved for being a disinfectant. And I threw a couple of arrows up there that it is appropriate as it is a rated disinfectant for, in this case, the human coronavirus and some other viruses that are out there as well. But again, what you're doing is you're validating and verifying the information. And you should have this on all of your portable containers. And if you're getting it at Super Stop and Shop or Big Y or some of the other grocery stores, you want to make sure that you have this information available to the people who are using it. And I think that's the last slide in the OSHA part. There we go. Okay, we're going to be handing this over to Adam, and take it away.
I'm sorry, I was on mute. Forgive me for that. So we're going to switch over now to the section of our presentation which deals with the legal challenges that employers are facing here in Connecticut. But first off, I really wanted to thank you for taking the time out of your day to examine these issues related to reopening your workplace in more detail. Part of the problem we're seeing with a lot of our employer clients is that there's so much information coming at them right now from law firms, consultants, professional services companies, that it's really overwhelming them, and it's very difficult for them to find a coherent, clear way to reopen because they're saying, oh my gosh, I have all this stuff, I don't even know where to start. So what we're trying to do here today is put all of that information into a clear, coherent manner so that you can actually have the ability to create a plan that works for you, to be able to ask specific and smart questions of your professionals as you're making your plan. That's very important. You may not have all the answers after walking out of here today, but we do want to give you the ability to ask the right questions. That's just as important. You may have been dealing for years with employment law issues, and as early as January, February of this year, when the COVID-19 coronavirus started spreading and causing issues in the workplace, you were dealing with issues related to firing, hiring, terminations, furloughs, layoffs, unemployment. There's a lot going on. And now as you look to reopen, you have to deal with all of those issues, but now you have to be challenged with the task of opening up or reopening your workplace in a manner that really puts your employees' health to the forefront, while also trying to find a way to operate your business in an efficient manner while doing all of that. It's a big task. So the purpose of our presentation, the second half here, before we get to the Q&A, is to really give you a roadmap as to how to create your reopening plan from an OSHA perspective, and also a plan that includes some protections from an employment law perspective. And then Christy and I are also going to walk through some of the common questions that employers are asking us right now as they reopen. I think a lot of those are going to be ones that you're going through as well, and then we'll turn to some Q&A. So at a very minimum, in addition to the OSHA protections that Rob and John laid out, you're going to want to make sure that your current employee manual addresses issues like expanded FMLA, expanded paid sick leave, and any other regulations that are coming out from the state of Connecticut and the federal government, and some guidance from the White House. At a very minimum, you're going to want to make sure your current policies are amended. What we are really looking at for our employer clients to do is to go one step further. The bare minimum probably isn't going to be good enough. And it's not going to be good enough because you want to make sure that your employees have a clear understanding and understand the expectations of how re-entry into the workplace is going to work and how it's going to look. And you can't really do that if you take a long employee benefit or employee plan and put all the COVID stuff in there. So what we're looking at is really creating these separate plans, whether you call it a return to work plan, a COVID-19 infection disease preparedness and response plan, whatever it may be, whatever you want to call it. We're going to walk through some of the elements and the factors you're going to want to consider and that you're going to want to include in that plan. So on this first slide, there's a bullet point list of the various things you're going to want to put in your plan. And we're going to walk through those in some detail. I will say that as it relates to social distancing protocols and some of the cleaning and hygiene pieces, I'm going to refer back to Rob's presentation. So first step, determining which employees return first. A big part of this is what John talked about earlier, is your risk assessment. Take a look at your workforce and look at how you can put them into groups, into shifts. Are there any commonalities in which you can break up those folks and bring them back in a phased or staggered manner? The guidance right now as it relates to phase 1, and I think the governor came out with phase 2 and phase 3 recommendations yesterday, but a key tenet in those is, as long as you can and as long as it's practical, encourage your employees to work at home for as long as possible. So long as they can do their duties at home, continue to focus on that. So again, the bullet points in the middle, consider phase reopening logistics, groups, shifts, split duties, etc. You really want to look at that first. Social distancing procedures and the cleaning and disinfecting standards. Again, go back and take a look at the slide regarding engineering and administrative controls. Those are really, really helpful. And again, what we wanted to do today was show you where all that information that you're hearing about on the news, in webinars, where does that fit into your actual response plan to get your employees back to work? And this is where it fits in. As I just said, part of phase 1, phase 2, and phase 3 is really encouraging folks to work at home. When you do this, and Christy may touch on this down the road when we talk about reasonable accommodations, but continuing work at home, if you haven't done so already, you want to set some expectations in writing as to what you want your employers to do, what their expectations are at home. There's different dynamics within the workforce. Some employees, some managers, some supervisors believe in work at home. Some don't. Some think that it's an opportunity for more vacation. Others actually believe that folks are actually productive when they're at home. So you really have to work hard to understand your workforce, set those expectations, and then communicate it with not only your employees, but your supervisors, who are going to be the ones on the ground monitoring this on a day-to-day basis. And lastly, it's worth noting, we are coming at this presentation from an employer perspective. So please understand that teleworking, while it does serve as an accommodation to some folks, as we'll talk about later, teleworking is not a right. It's a solution that is designed by employers to work for employers, I think, primarily. So I just don't want you to forget that as you're creating your plan. In-person meetings, client customer visits, and resuming business travel, you're going to want to have clear protocols for how you're going to handle this in your workplace. You know, as John had mentioned earlier, it's really employer specific, case by case, how you're going to handle in-person meetings in the office. It's really specific. For example, I have one client who's a benefit administrator, and they have older participants in their health plan who come into the administration office, and they want to have in-person meetings to go over their applications for various types of benefits. There are 6 different consultation rooms where that occurs. Now, that's a challenge to be able to meet with those folks on a daily basis, face to face, and give the customer what they need. You know, the solution there has been to add 6 doors and create partitions made out of plexiglass in the middle. So it's almost akin to 6 separate rooms with 2 separate entrances. There can never really be any contact. That works for that employer. It may be very different for a law firm or accounting firm or a professional services firm where the in-person meetings could perhaps take place over Zoom. I know before we jumped on here today, we had heard one stat that someone had spent 49 hours on Zoom meetings in the past month or so. So it can be done. So you have to just really make sure to take a look at what works for you when you think of these 3 factors. Managing the spread of COVID-19 in the workplace. This is really going to be the meat of where you're going to want to set your clear expectations. Number 1, you have to have someone in charge who knows and understands the CDC guidelines. As John alluded to, there is a lot of information out there, but you're going to have someone responsible for knowing those rules, or at least having the relationships with your service providers that do know those rules, so that there can be oversight. As it relates to managing the spread, what we really want to focus on now, and where the guidance is very clear, is that you want to encourage what we call a stay at home when sick mentality. It's true for everyone, but it's really true for folks who are in 2 categories. Those who are over age 65. So when you're doing your risk assessment of your workplace, you have to kind of carve out the folks that are over age 65 as an initial matter. And you have to also carve out folks who are in high risk groups. High risk groups could include folks who are immunosuppressed, have other underlying health conditions that their doctors say puts them in a higher risk category for returning to work. You're going to have to really give thought to how you're going to handle those people, and perhaps find other ways you can use them from working from home or other areas of the office where they're not exposed to as many people. You really encourage your folks to look at that. Lastly, you're going to want to have protocols for folks coming into the workplace. This could be customers, vendors, employees. You have to know the guidance from an OSHA perspective. You have to understand the CDC rules, the DECD rules, and also the anti-retaliation and anti-discrimination rules, which Christy's going to get into. You know, what can you ask? What can you do? What can't you do, more importantly? Put that all together. You have to really create a plan that works for you, but you do have some flexibility to do that. So what do you do when you have a positive test in the workplace. What do you do when someone comes and says, I ran into someone who had COVID and I think I got a little too close? What do you do when an employee shows up at the door, reads the sign that Rob put up and said, hey, I think I might have come into contact with someone with COVID? What do you do? And so the next two slides answer those three questions. What you want to make very clear in your return to work policy are the rules for your employees to follow when they have COVID with a test or when they don't have COVID with a test. And so we can walk through these fairly quickly, but the first group of people are those with COVID who have stayed at home. The CDC set forth a test or a set of return to work rules on their website. The link to that is here, and you'll get that in a PowerPoint after the presentation. But it really focuses on whether or not you've had a test or you haven't in terms of when you can come back. As early or as late as last week, the dates and times changed from 7 days and 3 days and 72 hours to now what you see before you. It's more of a 10-day period now for these folks. The second group are employees who have no symptoms but tested positive. What do you do with them? We put those answers in here as well. And you can see here, again, it's test-based by the CDC guidelines. If you've had a test, these are the rules. If you haven't had a test, these are the rules. If I could just back up one slide at the bottom, there's a whole nother group here who are going to cause problems as the phases and as the staggering becomes less and less and there's more people in the office. What do you do with employees who have been exposed to others who have COVID-19 or who are suspected to have had COVID-19? The perfect example, a lot of people are in their neighborhoods right now, perhaps getting out with the weather getting better. Maybe they're getting a little too close on the weekends. Those folks, you're expected to treat them as if they've had a positive test. That's the governor's advice. Treat them under this particular policy with regard to the 10-day rule, the 72-hour rule of no symptoms, and I think you'll be okay. So we'll move on now. So once you've had a positive case of COVID-19 identified in your office, what do you do in terms of making sure you can protect other folks in your office from not becoming sick as well? And this is the concept of contact tracing. In this situation, we put some bullet points here where the CDC has said, these are the things you're going to want to focus on. Trace and monitor the contacts of infected people and notify them of their exposure. Two things that I'd like to really point out here that I want you to walk away with. Number one is you have to make sure to maintain the confidentiality of your employees as you go through this process. It's obviously very sensitive. It contains a process where you're going to be gathering and storing a lot of protected health information. So you want to make sure you're following the rules as it relates to confidentiality, which we'll get to. And secondly, as you're developing your plan of returning to work and you're putting folks in groups, contact tracing has got to be something that you're thinking about while you're doing that. So for example, I have a client who operates a training school, and they used to have sessions A, B, C, and D run for 2 hours on one given day, followed by another session of 2 hours, followed by another session of 2 hours. So you're getting 4 different quote subjects all on the same day. What we came up for them is we broke them out into 4 groups where instead of 4 things in one day, you did one thing one week, group B the next week, group C the next week, and we were able to keep all the groups separate so that instead of having 20 people who all came in and out of one room on one day, you really only had a group of 5 people who in 1 week were in that one given room. So as you were coming up with your plan regarding how you're going to group, how are you going to phase, how are you going to stagger, please keep in mind the idea of contact tracing, and you want to make it as easy as possible to get to the bottom of what's going on. And in order to do that, you have to think about it as you're going. Coordination of your COVID policy with your existing policies. As I alluded to earlier, you're going to really want to make sure that your COVID-19 policies are clear and that they do not conflict with your regular PTO, your regular vacation, your regular leave policies. So to the extent you can, in a separate document, say, hey, we understand this is the rule for PTO, you get 30 days. But as it relates to being sick with COVID, this is the amount of days you're eligible for, and these are the conditions under which you're eligible for them. And you have to understand how those rules are going to work together. So I've put in here under the second bullet 2 common examples that Christy and I see with regard to how different types of leave coordinates with what I call the coronavirus laws, the Families First Coronavirus Act and the CARES Act. These are the rules that came out back in March and April, the first big laws that the Trump administration put out. But you want to make sure, my point is, that you have a way to coordinate those rules with your existing policies. This probably should have been number one, and I heard Rob allude to it, but communication of your policies is number one for several reasons. The first being, without the buy-in of your employees, your program of return to work is not going to be as successful as it otherwise could be. In order to get buy-in, you have to make sure that your employees understand what the obligations are. And the best way to do that is to communicate them clearly and effectively in writing. In addition to the writing, you may want to consider having a conference call or a Zoom meeting or whatever it may be before you actually send out via email or post your policy, which is probably going to be a rather lengthy document. It could be a good idea to gather your employees and say, hey, this is what's coming down the pipe. These are the types of things you're going to see. So as you read these policies, we want to make sure you understand what's going on. This is where you can ask questions, et cetera, et cetera. I'll move through the rest of the presentation fairly quickly. It's really important that you have someone identified at your company who's going to be responsible for not only knowing the rules, but also having a process to enforce those. If you have clear rules and guidance, you're going to be able to enforce them so long as someone is there to do it. And the last slide I have before I turn to Christy is just, again, rules are changing by the hour, by the minute, it seems like to us attorneys sometimes. We're having trouble keeping up, so I can't imagine how much trouble you're having keeping up. Make sure you have a provision in your plan that says, hey, things are going to change. Please understand that, and we reserve our right to change those rules. So with that, I will pass over to Christy to talk about some of the common questions that we're seeing from our employer clients.
Thanks, Adam. I think the information that you've gotten so far really gives you a good foundation to understand what you should be focusing on as you're reopening. But once you get to that point where you are rolling out your policies and you are you're at the point of bringing employees back and communicating with employees, and I've got several clients who are at that point now, and let me tell you that the response from employees really is driving a lot of this portion because clients are facing these issues on the daily. So, as part of your reopening plan or process, you're likely going to face questions or issues that will trigger your obligations as an employer under the Americans with Disabilities Act or the Connecticut Fair Employment Practices Act. And you may not have been an employer that had these issues come up often pre-COVID, but let me tell you, they are coming up now. And one thing to keep in mind is that the Americans with Disabilities Act applies to all employers. It's a federal law. It applies to all employers with 15 or more employees. And so while that may not get all of the employers that are maybe listening today, Connecticut's law, Connecticut's Fair Employment Practices Act, applies to employers with 3 or more employees. And so all of these concepts are likely to affect most employers that are listening today. And, Connecticut law follows generally the federal law. And so for the most part, we're going to be, everything that I say is going to apply to most employers. So generally speaking, employers are not at liberty to question employees about medical conditions, including symptoms that they're experiencing. For example, when an employee calls in sick, right? So as this would likely be considered a disability related inquiry that in your typical employment practices, you've been admonished, for years now as no, you don't want to ask these questions. But what I will say is that, as a general practice, you still want to adhere to the idea that you're not to be asking people disability related questions. except that now times are atypical right now, and you can ask questions that would normally be considered disability related if they're linked to COVID-19. So how much information may an employer request from an employee who calls out sick? Well, the EEOC, which is the Equal Employment Opportunities Commission, and that's the federal agency that administers the federal employment practices statutes, spoke up last month and rendered pandemic-specific guidance related to disability-type inquiries. And what they said is that during a pandemic, and this is specifically limited to this period of time now, employers may in fact ask their employees if they're experiencing symptoms related to the pandemic disease, to the virus, to COVID-19. So while the EEOC guidance doesn't give employers, carte blanche authority to start asking employees all sorts of medical or disability related questions about matters that are in no way related to COVID-19, we didn't open Pandora's box here. The leeway applies just for COVID-19. So you get an employee who you're back in business, and you get an employee that calls in sick, and you as the employer are permitted at this time to ask whether or not the employee is experiencing any of the following symptoms that the CDC relates to COVID-19, and I've listed them there. You're allowed to ask, are you experiencing a fever? When did it start? What's your, you can ask the temperature. You can ask about if they have a cough, shortness of breath, headache, sore throat, loss of sense or smell or taste. But if the employee, what you don't want to do is simply say, well, what are your symptoms? And make an employee feel that they have to tell you, a whole slew of symptoms that are not COVID related. So yes, you are allowed to ask these type of disability related questions. What I will say from a practical standpoint though, is you as the employer want to be careful about who you task with the responsibility of answering the calls of when people are calling in sick. Who's the person responsible from the employer standpoint, responsible for asking employees this information? You don't want to have co-workers necessarily just randomly asking co-workers, that call in. So you want to be very specific in your return to work plan. If you're going to call in, maybe that has to change at this time. You call a specific person. You call one person in HR, or you designate a single point of contact to ask the question, to call an employee back and ask the questions. And certainly the person asking the questions, you want to make sure that they're trained and they understand that the information they're gathering is confidential medical information that employers are obligated to retain on a confidential basis and store in a manner that is not accessible except for need to know. So, employers at this time, you're likely to have employees who may be returning to the workplace following an extended period of teleworking, or, if you've been operating all along, that many of our law firms have been, you may just be phasing in your employees after a period of teleworking. You could also have employees that you're bringing back off of a furlough or a layoff. You may even have new hires at this time, or simply you may actually have employees who have called out sick and now they're returning from a sick leave. So regardless of where your employees are returning from, the next question that we thought would be clever to respond to is, what can an employer ask an employee about his or her health before allowing the employee to return to the office? And Adam, in previous slides, went through the recommended guidelines for somebody who is recovering from COVID-19 illness. But generally speaking, the answer to this question is the same as the question, the question previously. The answer is that you as the employer are permitted during this time of the pandemic, to ask employees, even if the employee is asymptomatic, whether it's a new employee that you had no knowledge of, or of having COVID-19, or you've observed them and they appear to be asymptomatic, you can ask them COVID-related questions and about themselves and about who they've been in close contact with in their household, whether they've traveled recently. And I would say not only do you have the right to ask those, if we're thinking about what John and Rob presented previously, you kind of have an obligation to ask those questions, to have an understanding of your workforce. So, normally employers are not permitted to ask these types of questions, but what the EEOC has said is that since OSHA and the CDC recommends the precautionary measures be taken, it is absolutely reasonable and permissible and a best practice to ask returning employees to confirm whether or not they have symptoms of COVID-19, or if the employee has received a diagnosis for COVID-19 and what that diagnosis is. With respect to a doctor's note, and this is coming up repeatedly, employers are asking, well, can I ask them for a doctor's note? And the answer to that question is absolutely. You may ask your employees who have been out sick, the ones that have been out sick, for a doctor's note. But the caution that from a practitioner standpoint is it may be difficult for your employees to get a doctor's note that maybe that looks typical than what you're used to, that they actually presented in a doctor's office and they got this nicely handwritten note with a signature. So what you want to do is be flexible. I've seen them come through as text messages from a doctor, telemessages. I've seen emails, and so on and so forth. And then the last thing I'd like to caution about is, when you do, even if you've received a doctor's note, if the factors don't all line up, meaning that, maybe they called in sick yesterday with a fever and a cough, and then they show up today with a doctor's note, you still want to make sure that as an employer, you're checking all of the boxes that to ensure that that it is a recommended, practice for you to bring them back. The CDC guidelines say that they should have been out for, recovered at least 3 days without symptoms. The other thing is use practical common sense. If the employee comes to work with a doctor's note that says he's fine to come to work, yet he's hacking all over all the other employees, no, you should still turn that employee away, and you're well within your right to do so. So the next question is, can an employer take body temperatures before permitting their employees to return to the workplace or to even enter the workplace? Suppose you've been operating all along and you're going to put this measure in place. Generally speaking, under the ADA and the CFIPA, medical exams such as taking a body temperature are prohibited unless they're considered to be job-related and consistent with business necessity. And just as I said with the other questions, COVID-19, and because there is a pandemic, the EEOC has said that these kinds of tests and questions are job-related and consistent with business necessity. So employers may measure employees' body temperature, and the guidance obviously is that it should be done in the least invasive way, in a discreet manner, that the information, the recording of the temperatures and whatnot are considered confidential medical records. And so whoever is going to be doing this in your workforce, if you have a health professional on staff, you'd want to use them if you could. If you are having a supervisor or an HR person trained to do this, that's the key word. You want to make sure that they're trained, that they have the proper PPE, that they They understand how they're supposed to be interacting with the employees. You know, it should be done privately and in a manner that doesn't, if they're, you know, if you do have to direct an employee to go home, that you do it discreetly and so on and so forth. You know, employers, remember that you can send employees with a fever home, and you can require them to remain home and fever-free for at least 3 days before returning. So can an employer, right along the lines of the temperature, which, you know, seems to be pretty simple, you know, can an employer actually require an employee to have a COVID test before allowing the employee to return to work? And yes, the EEOC says that COVID tests are considered job-related and a business necessity because COVID-19 poses a direct threat. You know, employers are cautioned that, you know, requiring a test may not be the best way to measure if there's an exposure risk there because of the issues with false positives. But employers who are going to do this must ensure that they're using accurate, reliable tests, and employers should still observe infection control practices and making sure that even if you have a negative test, if the rest of the facts of the situation don't align, then you still should probably take action not to allow that individual to return to the workplace. So, and I touched on this just briefly with one of the previous slides. Is a doctor's note sufficient to allow an employee to return to work? And should I even ask for one? And my opinion as a practitioner, a legal practitioner, is absolutely yes, you should require a doctor's note. But you should be open to alternative approaches in what that doctor's note looks like, or what the medical documentation that you're receiving, whether it's for a return to work, whether it's for substantiating a request for FFCRA leave. You need to be open to the idea that alternative approaches to medical documentation should be accepted. And again, you know, you wouldn't want to rely on the doctor's note alone. So, and this is the $1 million question that I'm getting. And I've probably spent the vast majority of the last 5 business days that I've been working answering this question and advising clients. What if I have an employee who refuses to return to work? My take on this, and the best possible way for you to address this, is to make sure that you as the employer are engaging in communication with your employees as you're planning your reopening. And what I mean by this is, as Adam said, you know, talk to your employees while you're creating your plan. Talk to your employees before you roll out your plan to say, hey, here's the plan. And then if you get this question, or you get the employee who says, I'm not coming back to work, or I can't come back to work, you need to have a verbal conversation with that employee. And then you need to communicate with them in writing also to follow up your verbal understanding. Because what I'm finding is employees are saying, I can't come to work. Well, why? Why can't they come to work? What is their reason? Is it that they have a fear to return to work? Is it that there's a reason that maybe somebody didn't explore with them? Maybe they are nervous to say why, but it's really important to understand why the employee refuses to return to work. A fear of infection alone is not a sufficient basis for an employee to simply refuse to return to work. And as the employer, if you have an employee who simply just says, I'm scared of getting sick, then you as the employer have the right to say, well, I'm sorry, I've offered you the return, I've offered you or I've directed you to return to work and you're refusing. But why the communication is so important is because an employee's fear or an employee's refusal may actually meet the FFCRA criteria for paid sick leave or EFMLA. And you want to have an understanding. You know, the employee may just say, oh, I'm sorry, I'm not coming to work. I'm scared of getting sick. When the real reason is that the employee has children at home and they can't come to work, or they may have been able to telework, but now they can't return to the work site because they have school-age children at home who they can't leave alone all day because schools are closed. Well, that's a qualifying reason for EFMLA. And if you just take the kind of the relayed message from the supervisor is so-and-so it says they're not coming back, and you don't explore it, you could, as the employer, find yourself in a position where you've interfered with the employee's rights for EFMLA or paid sick leave. The other reason is the employee's fear may be related to an existing physical or mental impairment that you, prior to all of this, as the employer, may have never known existed. But that physical or mental impairment, maybe they're immunocompromised, maybe they have a mental health condition that didn't rear its head until the stress of COVID-19 came about. And so you, as the employer, have the obligation to make sure that you're in compliance and interacting with your employees to determine whether this is a situation that warrants regular FMLA. Are you an employer that has 50 or more employees that would normally be that is subject to the regular FMLA? Well, this could be a serious medical condition. The person could be caring for an individual with a serious medical condition. We want to make sure we're checking the box on that. And then certainly under the Americans with Disabilities Act or CFIPA, we're not sure yet if COVID-19 can be considered a disability, but certainly you want to have an understanding and be able to have a thoughtful conversation with your legal practitioner as to whether or not what your employee is relaying to you is something that you need to engage in the interactive process and possibly accommodate with additional leave and so on and so forth. And then keeping in mind, obviously, if none of these other reasons exist, unemployed, and you've asked the employee to come back to work and they refuse, you know, the employee, there's unemployment compensation issues. You know, an employee may be awarded unemployment comp even if they refuse to work, if they're able to establish through a fact-finding determination with the Department of Labor that they are unable to sustain work at this time.
So I just wanted to follow up real quick on what Christy had mentioned, because it's a timely example. It's very important when you're dealing with employees who are refusing to come back, as Christy said, to kind of really walk through and understand what the condition is, because it may have been something that existed that didn't matter before, but matters now. And literally 2 hours before we jumped on today, I had an employer who had an employee who has a skin condition which requires a particular type of immunotherapy, which on any other given day prior to COVID-19 wouldn't have made a lick of difference to that employee's ability to work. But now the treatment for that condition, which the employer was thoughtful enough to inquire about, is something that would make that particular employee particularly susceptible to COVID, and we can excuse them from work on that ground. So I think Christy's point is probably one of the best ones we can take from this whole presentation from the employer side. It's be open, communicate with your employees, and really understand. That's really important. And that goes to the whole issue of buy-in. So the next piece on our presentation has to do with confidentiality. I know we want to get to some Q&A, so I won't spend too long. Any medical information, whether it be responses to the self-health assessments, whether it's questions you ask and take notes on of employees before they return, whether it's a contact tracing exercise, you want to make sure that that information is maintained separately. That's required by the ADA. It's required by Connecticut law that we put in the first bullet there. You want to make sure that that information is kept separately in accordance with state rules. federal rules. You can reach out to your attorney to get a grasp of specific questions related to that. And also, as Rob had talked about, the OSHA record-keeping guidelines, protected health information can find its way into those documents as well. So you want to make sure you're handling those in a confidential manner, and that the person who is responsible for keeping and maintaining that information understands those rules as well. So we'll move on to Christy again.
So, and I've touched on this kind of in the other slides, but while the EEOC has sort of expanded the questions that an employer might be able to ask related to COVID-19, one thing that I do want to make sure that everybody understands is that employers still, even in this day and age, still have the obligation to engage in the informal interactive process when their employees are presenting them with requests for accommodations. And I mentioned it, unclear at this time is whether COVID-19 is or could be a disability under the ADA or CFIPA, but I do want to make sure that we are all aware that even temporary incapacitations, such as a broken leg, can require accommodations, and a reasonable amount of leave could be a reasonable accommodation in certain situations. So it's very, very important for employers rather, to understand that they still have their obligations to engage interactively with employees. The one thing that still exists also is employers do have the right to require medical documentation to substantiate unapparent disabling conditions, and they still have the right, the ultimate right, to determine whether or not a requested accommodation is reasonable, or if it, or not, because of an undue hardship. Those employer rights have not been eviscerated by this whole process. But certainly, accommodations work, whether it's an accommodation needed in the workplace or an accommodation needed while teleworking. Telework itself could be an accommodation, or whether certain required PPE that they are obligated to use in the workplace, whether that needs modification because of a medical condition. Those are all hot topics that really you should be able to spot as an employer, and supervisors, especially the people that are interacting with your employees on the day-to-day, need to understand that there's no magic word that triggers your obligation to accommodate an employee, but they need to understand that if employees are raising these concerns, or they mention something off the cuff, well, I can't wear that because it bothers my blah, blah, blah. I don't know, just throw something in there. Supervisors need to keep an ear out as to whether or not there may be a hidden request there. One thing I will point out is that the Connecticut Executive Order 7BB, which requires PPE in the workplace, and the Department of Economic Development and Community Development guidelines for masks, they're very broad, and they say if an employee comes to you and says, I can't wear a mask in the workplace because I have a medical condition, those guidelines actually say you can't request documentation about that medical condition related to the use of a mask in a workplace. Well, that opens up a whole other can of worms that we can get to on another day, because you may have immuno-impaired employees in your workplace, but then employees who are saying they can't wear a mask because they have a medical condition that they don't have to substantiate. So I do want to raise those concerns, and we want to get to some Q&A. But those are, accommodations. This is a black hole in terms of where, every angle that you can get hit with a request for an accommodation here.
It's our last topic of the afternoon before we hit Q&A. I don't think there's any dispute that everybody wants to get back to work and back to normal, and at the front of everything is everybody wants everyone else to be safe. We all agree on that. But what we want you to understand is that, and Christy just said this best, so I'll repeat it. Employer rights have not been eviscerated. They still exist. And so as you create your COVID-19 return to work policy, or whatever you want to call it, you have to understand that you still have your rights as an employer to discipline your employees in accordance with your policies that not only you're writing now, but the ones that existed prior to the pandemic. So be prepared to discipline your employees consistent with those policies. If there's not a valid reason for not coming to work, as Christy just walked through, then enforce your policy, and that job may not be there. You know, be sure to not retaliate, do not discriminate, call your attorney if you get into a situation where you think you may have an issue there. But you want to really protect your employees from other employees, from yourself, but you can still enforce your own policies. And again, I think you've heard this throughout the day. It's really a balancing act. You have your right to run a business according to the way you want to run it under your own rules, but you also have to be really aware of the employees and their health and safety concerns, and then the guidance that's out there telling us how to go about doing that. So in the end, operate your business, create a great plan. I think you have the tools to do that now, but don't let your employees unreasonably impair your ability to return to work. And with that, I'll toss it over to John.
All right, so I'm going to do a real 1-minute wrap up here. If anything from this program, what you should be thinking about and highlighting are things: prepare a plan, have a plan in place, have your PPE ready to go. Make sure you've got supply chains identified when you start running out of your PPE. Communicate with your employees. Let them know what you're doing and why. Stay current and be ready to adapt. Be ready to bob and weave as new regulations and guidances come out. And how are you going to do that? You can try and manage it on your own and designate to do it, but there are resources. All of the panelists here are with companies and firms that have resources. We have a COVID-19 website at our law firm, and we keep up with as much of these policies as we can. We provide links. And we also cover other topics. You're going to run into issues dealing with your payroll protection plans, perhaps, and your financial obligations, false claims, contract claims that may come up as either your vendors or you are not able to comply with your contract obligations, including leases, insurance claims, and insolvency. All of these are issues, that little things that you're going to bump into as you go along the way. You've got resources out there, use them. And I believe, and I think Joanna's going to wrap up as well, but I think this slide presentation is going to be available to you. It's available on our website, as I think all these other presenters have it on their websites as well. I'm going to stop at that point and hand it over back to Joanna.
All right, great. Fantastic job, everybody. You know, we're in the process of putting our stuff together now because we're going to be bringing back people on Tuesday, and we've got some done, but I feel like I'm way behind after listening to this, so I'm going to have a busy week, and I'm trying to pull all that together. So if anyone has any questions, please put so in the chat. I did get some on the email, which I'm going to ask you now. Actually, I did receive a few emails, but you guys covered a lot of it. So as far as in the CT reopens document for offices, it says a daily health check. Does this need to be documented?
I can take the first stab at that. So you're always going to want to document everything you do. To the extent there's issues down the road, for example, there's claims of a wrongful termination, or that's probably the worst case scenario, or discrimination or whatnot. As any, I think Christy will agree, employment lawyers live by the 3 words: document, document, document. You should document these, but the caveat is, and you can go back to the slide, if you're going to do it, make sure you're being discreet and do it in a confidential manner. So 2 examples. It may be that you email these daily self-health check assessments out and simply have your employees respond before they come in via email or a text to someone identified as the gatherer of the information. Yes, no, yes, no. You could do it that way. I have another client who runs a training center outdoors. Folks, our employees come one by one in their car, and they pull up, and there's someone there with PPE, and they walk through, have you this, have you that, and they walk through the certification, but they keep 20 yards between the cars so that no one can hear it. So they're actually taking a documentation of who showed up, who answered the questions, how they answer them, and then that information is stored in a separate file.
Interesting. All right, thank you.
Can I
for that.
just, I'll just add
Sure,
one,
Chrissy.
can I add one point to that? While keeping in mind from a wage and hour standpoint, and possibly if you're in an employment setting where there's collective bargaining agreement that might be in place, you also want to make sure that if you are doing it in this, like in the second example that Adam said, that your employees are required to show up, either that maybe they have to report early or it takes them time in their car. That is compensable work time. And you want to make sure that you're paying them and complying with wage and hour laws also. That's the other thing. And I think from a liability standpoint, with respect to the wrongful termination or the discrimination case, but also to Rob and John's points earlier about liability for, suppose there's a claim of liability for exposure. Somebody is injured because they've been exposed at the workplace. You want to make sure that you have that documented so that you are able to defend a case like that with all the documentation. Well, we did this every single day, and that person, you know, who never reported to us that they had symptoms was actually you want to make sure you have that documentation so that you have it handy to pull out later on.
Okay, speaking of documentation, is a text considered documentation? Yes?
Absolutely.
Yes. And I would say in this environment, it's probably the best kind of documentation because it's not taken face to face.
True, very true, very true.
Right, and even along the lines of the doctor's notes, I've had clients that are sending me that's all they're required, that's all they're able to get from their employees. Their COVID test results come in a text message. Their return to work notes are coming in a text message, and that's what they're getting from employees is the screenshot of a text message.
Yeah, okay, that's interesting. Well, it's good to know.
I will add to that, not to belabor the point, but there are, depending on who's in charge of gathering the information, you want to make sure as an employer that those people understand the technology behind saving screenshots, how to save a text, because you'd be surprised how many folks say, oh, I got a text, well, give it to me. Well, I don't know how to do that. So it sounds crazy, but you want to make sure from an employer's perspective that the folks who are gathering information understand how to gather it and then keep it confidential.
Yeah, absolutely. Good stuff, guys. So this is more for essential businesses. Do essential businesses need to have a daily employee log now that we're open?
Yeah.
Well,
Yes. I will take a stab at that also. I know our office is an essential employer, and we have been maintaining daily employee logs of people that are in the workplace, and it's as simple as sending if you're going to be in the office today, sending an email just so that we know who's here and what clients might be coming into our office, and so on and so forth.
Now, on that log, are you asking any specific questions? Like, have you traveled? Have you, because I've seen a few that we've received from members who are sharing their information, and it's very specific to, I've traveled out of the state, I've traveled here, so how detailed should it be?
that's going to depend upon the business. And,
Okay.
For those businesses where employees are coming and going, knowing where they've been is probably essential. Or if you're expecting, for example, not to pick on New York City, but if you're expecting a lot of folks coming from hotbed COVID areas, you may want to ask those questions.
Yeah.
But some employers, may decide that's not an essential question for them. So it really is tailored to the business.
One thing to add to that is when you keep your log, whether you take if it's required or later on the road, it's not. Yeah, the notion of contact tracing and making your life easier if you do have an issue comes to play here. So if you do have a log with, at a minimum, the time in, time out, and the name of the person, it's going to make it a lot easier for you if you do have an incident to actually figure out who else may be exposed and to implement your plan.
Correct. And actually a question just came into the chat about how detailed. Can an employee simply answer yes or no for a set of health questions? What should the list of questions consist of? Yes, how detailed is the daily question? And, I think that's what you said before. It's specific to your company, what you want, correct?
Yeah, and it can be yes or no's. It
All
could be
right,
as simple as that.
The one thing I would note is with regard to a fever, the CDC guidelines do say that it's a fever for COVID purposes is 100.4 degrees, unless that's changed since the last time we checked. So, but you know, you do see employers taking temperatures and asking the questions, but then don't understand that 100.4 is the number they're looking for. That's really important.
Yes, I just learned that one yesterday after reading all that to get myself up to par. So here's another question that came in via email. What do you do about, I'm sorry?
Just one quick follow-up that I want to punt over to both Christine and Adam. These records that people create for what I'll call their self-assessments, if they're providing specific information about their health, are those documents that then have to be maintained by the company as confidential documents?
Yes, absolutely. And what the Connecticut Personnel Files Act says is that those types of records are considered medical records. They need to be maintained in a file separate from the typical personnel file, and they need to be maintained in, you know, in a secure location where they're not accessible. So, you know, you may have the HR department or the executive director that is the only person that has a key, but those medical files have to be maintained separate from the employee. They're a personnel file, but they must be maintained separate from the regular personnel file. And that could look like a separate tab in the same file, but they need to be maintained separately.
That's good information. All right, I know we're getting tight in time. We wanted to stop at 3, but then we've got 2 more questions that I think are important to ask. What do you do if a person notifies you they tested positive and has been into work? Do I have to notify everyone on that same shift?
Yes.
Yeah. So the answer is yes.
The answer is yes. Well, you know, but you have to be careful too. Again, you have to maintain the confidentiality of the person who's reported. So you can go to the people on the shift and say, look, you know, we have information to believe that you may have been exposed through work to somebody who's been exposed to COVID-19. And therefore, if you know, depending upon the plan, the typical plan would then say, therefore, you need to remain at home and follow the CDC guidelines for return to work. But you do have to let the other employees know that at least that they have been exposed. But be careful with confidentiality. You can't rat out the person who basically reported the information to you. You may figure it out, but you have to maintain that. And I'm going to defer to Adam and Christy, but that's my understanding.
Yeah, so I can just jump in real quick on that. And when you get the PowerPoint, it's on this slide. It's actually the first bullet point under contact tracing. This is a CDC guideline recommendation: trace and monitor contacts of infected people. To me, that's pretty clear. If there's not even a reasonable chance, if there's a chance that someone could have been in contact with that person who tested positive, it's well within their right to know that happened to them. So while the confidentiality of the person who had the test is important, it's a balancing act between that and making sure you're carrying out your duty to keep others safe. And so, you know, if you're an employee, you'd want to know if Jimmy tested positive for COVID and you happen to be in the kitchen 10 feet away. You know, you want to know that.
Well, you don't know it's Jimmy. You just
Yeah,
know
I was just going to
somebody.
say, you don't want to know. The employer don't say it's Jimmy. But, you know, I think the concern from employers is that, well, if I say we're a small workforce, if I say that somebody tested positive, everybody's going to be able to figure it out. Well, that's just the reality of the situation. You as the employer, though, don't want to send out any kind of communication, whether it's verbal or written, that says, you know, Jimmy did this or Jimmy has this. It's just an employee. And that's all the employer needs to do. If employees can figure it out through other facts and circumstances,
That's on them.
That's just the reality of the situation. But as the employer, you do not want to be the one that sends out the information of the personally identifiable information.
So just to add to that point, you know, in the very first slide, we talked about, you know, which employees come back first and doing things in groups. It's a very easy solution to that is if you put people in groups, you can say someone in group A has been has tested positive, and then you can treat that whole group. That's partly why we did that first. Yeah.
That's a great suggestion. All right, this this one, I hope you guys can answer this one, but I think it's pretty interesting. If I allowed employees to drop their flex spending account or dependent care account due to COVID-19, do I have to amend my section 125 plan? Two
We'd
different
be
people
happy to
asked me
take that.
question. We'll get back to you on that one.
I could take that. We'll take that one offline because that one could go for a long time.
No worries, no worries. And I really appreciate that because I will be sending everybody the slides after and along with their websites and their email addresses so everyone can contact them. You guys have done an amazing job. A lot of information that you covered and really made it pretty basic and easy to understand. So we do appreciate that. It's a different time. And I think that, so many people like yourselves are stepping up to the plate to help our small members and our membership really answer a lot of these difficult questions. So thank you all for being here today. I truly appreciate it. And I wish everybody a fantastic Memorial Day weekend. It's supposed to be beautiful weather, so get out. I've never seen yards look so beautiful, so it's all good. But thank you very much, guys. Have a great day. Thank you for those who have joined us. We appreciate it. And watch your emails.
Thank you.
Thank you.
Bye, everybody. Have a great weekend.
You too.
Thank you.